get started, everybody. Hello, welcome. My name is Susan Vaughn. I'm the Program Administrator for the Master of Science in Psychotherapy here at McMaster University. So thank you all for joining us today. I just want to apologize. Unfortunately, our program director has been called away on a family emergency. And because it was very last minute, we didn't want to cancel the event. So we're going to go through it as planned, but you'll just have to bear with me as I'm going to do my best to make sure that you have all the information that you need. Okay, so first what we're going to do is I will be playing a recording of last year's open house. And this is just to give you a better sense of the program and the application process. And then after that, I actually have 3 current students who are going to be joining us this evening, and they're going to be talking about their experiences in the program and the application process and how they found things. And then at that point, we'll take questions. Please feel free to put them in the chat, and I'm going to do my best to respond. If you do have a question that is more relates to your personal situation, please email that to us, okay? And then I will respond back. And the email address that you need is mscpinfo@mcmaster.ca.
Connecting with this evening. So I'll just introduce myself. My name is Elizabeth Pollock, and I'm the director of the Masters of Psychotherapy Program. So thanks so much for joining us this evening. I'll also introduce Susan Vaughn. So Susan Vaughn is our program administrator, our kind of go-to individual about all things administrative for our program. Some of you have maybe even been in correspondence with Susan if you had some questions. So Susan is sort of your go-to person if you have questions about your application. I will share that we are getting many questions over email, and unfortunately we really can't respond to each individual question. So sometimes we can give sort of a general response back if you have a really sort of specific question, but I will share that unfortunately we are not able to review everybody's application ahead of time. So you know, we realize there's a lot of questions coming in, and so just bearing with us and giving us some time to get back to your questions. Okay, and then we also have 2 students from the program joining us tonight, so Sarah Salerno and Laura Grennan. Both of them are going to touch about our program association, so the Psychotherapy Graduate Association that they're involved in, and then they'll also share a little bit about their experience for choosing McMaster University and their experience so far in the program. So both of them are in their 2nd year in the program. Okay, so thanks again so much for joining us. I'll encourage people to use the chat function if you'd like to ask a question. If you have a specific question for Sarah or Laura, you can just indicate maybe at the beginning of your question that this is a question for a student. But if you have general questions about the program, we're happy to answer those at the end of the presentation. So Susan will sort of moderate those questions and we'll go through them come the end of the presentation. Okay. All right. So a little bit about kind of who we are. I mentioned already, gave some introduction. So I just wanted to put some contact information up for people. So again, connecting about admissions to the program or program information, you'll be speaking with Susan Vaughn, our program administrator, and you'll see her email address there. So MSCP, which is Masters of Psychotherapy Program, at info@mcmaster.ca, and then my contact also, so pollock@mcmaster.ca. Okay. So a little overview about what is involved in this program. So hopefully many of you are aware that this is a master's degree. So it's a professional course-based degree. And what that means is that there's no research component to this degree. So the anticipation is that for a professional program, people are joining the program with the goal of gaining competency in a specific profession to go on and sort of later seek licensure or registration with that profession. So we're sort of a similar program to occupational therapy or physiotherapy, for example, where really the training is to come and get in-depth experience that will lead you towards a specific profession. So just to reiterate, in this program, there is no research component. So you would never do a thesis or be connected with a research supervisor. I always like to put that out there because I think when people think about a master's, that's often what comes to mind, but this is a little bit different than that. Also, with that said, because there's no research component, there's also no requirement of a defense, right? So people graduate from the program based on course completion, completion of practicum and clinical experiences, as well as a sort of general review of students' competencies that they've gained over the course of the program. And how the courses are designed is to first provide students with an introduction to psychotherapy, the theories of psychotherapy, with a specific focus on cognitive behavioral therapy and theory. So really to give people a good understanding of one core type of psychotherapy. So with that said, what's involved is 7 core required courses, so introductory courses and then advanced courses in cognitive behavioral therapy and applied skills. Students also are required to take 2 elective courses. These are often more breadth experiences, so maybe they take a course in a different type of psychotherapy. So for example, introduction to acceptance and commitment therapy, or introduction to interpersonal psychotherapy. So that's a way to sort of get some breadth beyond cognitive behavioral therapy and some exposure to different forms of psychotherapy in this program. And then another required component of this program is the completion of 2 clinical practicum, which I'll talk about in just a few minutes. So a little bit about the program structure. So currently we're enrolling about 25 to 30 students a year, just depending on kind of the admission cycle. It is a 5-term program, meaning that students start in September and they complete almost just over a year and a half later, so the following April. So it's a full year, and then students again start their 2nd year in September and complete that following April. So not the one kind of last term they don't do is that summer term. So you do graduate from the program in May. The class format is in person, so obviously during COVID, there were many times where the class were moved virtual. Our first cohort through the program completed the program entirely virtual, but we've been fortunate enough to be able to move back into the classroom this fall, and fingers crossed it all goes smoothly. So far, I know from hearing from students and instructors that it's a really nice experience to get back into the classroom. So we're really hoping to stay that way. And another reason why we think that's so important is because of the experiential components that are involved in each course. So there's lots of opportunities for role play, working with simulated patients, for example, and that again is, we think, a really rich experience when we can do that in person. A little more about kind of where the program is situated within the university. So the program is the program home is within the Department of Psychiatry and Behavioral Neurosciences, which is within the Faculty of Health Sciences at McMaster. And that is why we are also a Master's of Science degree. So the program is really based in evidence-based practices, and that's a core principle of the Department of Psychiatry, as well as the Faculty of Health Sciences. So instructors in the program come from the Department of Psychiatry and Behavioral Neurosciences, and these individuals may be psychotherapists, come from the field of psychotherapy, social work, psychology, psychiatry, nursing as well. We don't have that listed, but we also have involvement with nurses. And because of that, what's quite interesting about the Department of Psychiatry is that it's actually housed at the West 5th campus of St. Joseph's Healthcare Hamilton, which is a hospital in Hamilton. And the West 5th campus has a main mental health focus. So that's where our anxiety disorders, mood disorders, eating disorders, lots of different kind of specialty clinics are actually housed at West 5th. So as a student, you can come and take your classes within the hospital setting and really have a quite immersive experience into a mental health facility. So some of our classes may happen on main campus at McMaster, and then others will happen at the West 5th campus. Okay, so just a little bit more about the program timeline. So the program is sort of divided across 2 years. So year one, as we mentioned, the program launches in September and you complete your first term. In that first term are really your introductory courses. So we want to make sure that all students start with the same foundational learning. So you would complete the Introduction to Mental Health and Wellness course, which is initial exposure to mental health disorders and problems. You would complete an Principles of Evidence-Based Psychotherapy course, which again is exposure to different types of psychotherapy and psychotherapy theory and the theory behind different types of psychotherapies. And then you would also complete an assessment and case formulation course, because it's important for psychotherapists to be able to identify, what is the main problem of the people that they're seeing for psychotherapy. So I always like to give the note, because we are working towards, many people are working towards registration with the College of Registered Psychotherapists, and that profession cannot provide a clinical diagnosis, but it is still important to be able to identify the mental health concerns of the individuals that you're working with. Okay, in term 2, it starts to become a bit more transitional from sort of a theory to a bit more applied. So in term 2, you would take a cognitive behavioral therapy course, which is starting to get exposure to different skills and strategies that you would provide to your clients in psychotherapy. You would also complete an ethical standards and professional practice course. Again, really important prior to completing any clinical practicum, that you're aware of the kind of clinical guidelines and requirements of being a psychotherapist or a student providing psychotherapy. And then the last course that is a required course that you would complete in that second term is our Introduction to Psychotherapy Research course, which is a course geared towards providing people with skills on how to read psychotherapy research to then go on and help inform their clinical practice. So as I mentioned, this program is really geared towards giving people skills in evidence-based practice and evidence-based care. And to provide evidence-based practice, you have to be able to consume ongoing psychotherapy research to help inform your clinical practice. So it's really an important skill. Then into year 2 really becomes your applied year. So your year 2 starts in the spring-summer term, where you would complete your first practicum. And this would be a 2 to 3 day a week practicum, where really you're starting to get sort of immersed into the clinical experience. For many students, this is more of an observational practicum, where you're sort of observing maybe group therapy, maybe you're doing co-therapy with a supervisor, you're observing assessments to really start to get some exposure to what clinical work looks like. Now, again, based on your own experience coming into the program, if you've already started to do some clinical work external prior to joining the program, then you might be at the step where you're ready to sort of start seeing some individual clients or really jumping into psychotherapy, but it just depends. We really follow a bit more of a developmental approach for these practicums, so to meet you where your learning is. Then moving into the fall and winter, you would take an elective course each term. And then you have an applied psychotherapy skills course, which is, again, a really applied course where you're doing role plays, you're learning and practicing skills, you're working with simulated patients to really hone your psychotherapy skills. And then at the same time, you'd be completing a practicum, which would be a 2 day a week practicum. So just to sort of think about expectations around commitment while you're in the program, it is a full-time program, meaning that it's expected that people treat the program as a full-time job. So it's anticipated that, if you're on, let's say in the first term, if you're taking 3 courses, it might not seem like, well, that's not that many. I could probably, work a part-time job at the same time. But what we really hope and the expectation is that each course should be about 10 hours of learning a week. So yes, the lecture itself may only be 3 hours, but when you think about working on assignments and doing the required readings, we really do expect it to take up a substantial amount of time. Also, as a graduate student, a full-time graduate student, based on School of Graduate Studies rules and regulations, that students are only allowed to work outside the program at most 20 hours a week. So that's just something to be mindful of. If you're thinking that maybe I would do this program and then have a part-time job, what I would say is it's probably going to be very stressful and overwhelming because it is quite an intensive program. And then also thinking about doing the practicum, those will take up 2 to 3 days a week of your kind of time at that time. So it is really hard to kind of manage additional, outside expectations at the same time. So I always like to just share that with people just to sort of set kind of realistic expectations while you're in the program. Okay. And it is only 20 months. It's a very fast 20 months. I can imagine Sarah and Laura are already kind of surprised. They're more than halfway done the program at this point. And so we really do encourage students to immerse themselves and get as much out of the training as they can during that time. Okay. All right, so you now have a little overview of kind of what to expect, the courses in the program, and then kind of more of a transition to sort of think about, well, why would I join this program? Like, where would it lead me to, right? And so really this program is geared towards people who are interested in a career as a registered psychotherapist. So again, I think that's an important point to take home, right? So if, let's say, you're here with the goal of maybe going on to become a psychologist or going on to do a PhD in clinical psychology, this is probably not the master's program for you. Okay, so this program, because it doesn't have a research component, which would be the requirement of entering into a PhD, this really does not set you up for that type of trajectory, educational trajectory. Also, there's quite a difference in training in those two fields. So this program really was developed to fill kind of a need in that the new college, the College of Registered Psychotherapists, came into effect in 2015, and there really weren't specialty training programs for that college. And so that's why we developed this program, as sort of something to fit those training requirements with the College of Registered Psychotherapists. So again, our goal is to sort of get people the competencies that are required for the registration with that college. So what is a registered psychotherapist? A registered psychotherapist is somebody who provides psychotherapies to individuals with the goal of improving or maintaining their mental health and well-being, right? And so this can, psychotherapists can work with all different types of individuals with all different types of mental health problems. And as you go through the program, you'll start to get a sense of what is the area of kind of mental health that I want to get competency in. Maybe I like working with people with anxiety, for example, or people who, struggle with career-based decisions, or maybe people who struggle with substance use. Maybe you start to kind of develop an area of niche, right? And you can think about, can I do a practicum in that area and really evolve and develop my skills in that area? So that's kind of a little bit about that. So really with the goal then in the program is to sort of meet those training competencies required of the college. So just building on that, because again, I think this is a relatively new college to Ontario, and I think sometimes people, when you look at different training programs, sometimes it's quite confusing about what are the different options and where can I go. So psychotherapy in Ontario has become now what we call a controlled act, meaning that only people who are registered in certain regulatory colleges can provide psychotherapy. And in Ontario, there's sort of 5 registered professions that can perform psychotherapy. So registered psychotherapists, social workers, nurses, physicians, occupational therapists, and psychologists. Right? So before the college came into effect, anybody could call themselves a psychotherapist and provide therapy. And now the college is has grandfathered in people who have been working prior and has now set really strict criteria about the type of training people need to become registered with the college, right? And one of the training requirements now, in many cases, is a master's degree. So what students then do, you complete our program, build up your competencies in this area, and then like all other professional programs, so similar to OT, social work, nursing, psychology, once you're done your program, you join the college of that profession, right? And so for registered psychotherapists, that would be the College of Registered Psychotherapists of Ontario. Now, again, the college is the regulatory body, and so they are functioning to serve the public and protect the public from psychotherapists who may provide or may not provide appropriate care, right? So that really is the function of the college. One thing I always like to share is because this is a body completely separate from our program, we don't have any ability to ensure that you are registered with the college, right? We provide you the adequate training, but you in your own abilities have to complete licensing exams and meet the minimum requirements to become registered, right? And then you go through a supervised phase once you join the college. Now, because we are a relatively new program, some of you may be wondering, have any of our students become registered? And I can share that many of our students who graduated in our first cohort, so we've had one graduating cohort so far in the program, they have become registered. So that was a nice sigh of relief for all of us in the program, that it does appear that our program meets the requirements of the college and people have been successfully registered with the college. Related to that, we get lots of questions about, is this program recognized by the College of Registered Psychotherapists? And I want to just share at this point, because we've only had a single graduating cohort, we can't actually apply for registration with the college yet. They really have set the guidelines that we need 2 graduating cohorts before we can apply for recognition. And part of that is what that means for the college is that when you go to apply to the college, they just know and are aware of all of the learning that you would have gained in our program. And so then when you submit your application, they don't have to do such a thorough review of the application that you submitted, because they would know all the coursework that you've done and the competencies that you've met. So it's not that the college necessarily accredits any program, it just makes your application process a little bit smoother when you come from a recognized program. So what will happen is when people graduate from our program, they submit a mapping tool, which just shows how our program maps onto the competencies. So it's just an added step. Now, thinking about admission, for those that are interested in applying and admission to our program, hopefully by the time you go to graduate, we will be a recognized program. So it may not even be an area of concern. Okay. And then a little bit about well, where does a career as a registered psychotherapist take you? And so, even students in our program are working in a variety of settings now. So some are working at hospitals, some are in private practices, some are working in community-based agencies. So there's a lot of opportunities post-graduation about where registered psychotherapists can work. And then beyond our program, there's lots of people working in university counseling centers, family health teams, addiction rehab programs, employment assistance programs, right? So there's a variety of places that you can work as an RP. Okay, and then a little more, which I'm sure many people have questions just about our admissions requirements. So as it states on the website, admissions requirements include an honors bachelor degree in psychology, social sciences, or health sciences. Some people have questions about, are there any specific required courses to complete this program? And at this time, we don't have any requirements that we look for necessarily, right? So, one thing as we review applications, we want to see that maybe you've had a keen interest in psychology and maybe have taken some psychology related courses. But that said, we've had students from social sciences programs that haven't taken sort of psychology specific courses. So it really just depends on the person. We do look for a B+ average at minimum. Now I will say, because we do get many applications, so last year we had over 400 applications to the program. Often the minimum requirements at a certain point, really, we're sort of looking beyond that, right? So that's just something to be aware of. And then a requirement is that if your first language is not English, and you did not attend an English-speaking undergrad university for your undergrad, then a test of English proficiency is required. The other things that we want you to submit alongside in your application, so one is a curriculum vitae, or CV. This is a really important document that helps for us to understand your experiences prior to entering the program. So it does not need to be a brief 2-page resume, but we actually can see sort of multiple page documents where you outline your education experience, research experience, if you had any volunteering experience, relevant work experience, and actually like detailing what you did. That's really helpful. So you don't need to keep it to a brief sort of 2-page resume, but actually really highlighting what you've done in your training, because that gives us a better sense of who you are and what your experiences have been. This year also, we're going to be asking people not so much to write out just a kind of an essay, but really what we're asking people to do is answer a series of questions kind of about their experiences and expectations through the online application portal. I know Susan's had a couple questions where because we previously had a statement letter, there's a bit of a glitch, it sounds like, in the system where it's saying, you're missing your statement letter. If that happens, we're just asking you kind of upload a blank document to that place, just so that your application doesn't get held. It seems like for just some people, there's a bit of a glitch. I don't know if it was just the crossover to the new program or what happened, but if that does happen, just upload a blank document there. Okay, and really it's important that you answer all of those personal statement questions held within the application on the portal. We're also asking that you submit 2 letters of reference. So it is preferred really to have academic references, so people who know your experience and sort of the relevant experience to the program. So this could be a class instructor, somebody that you worked with on a research project. Those are really kind of the preferred references. If you've had, let's say you've been out of school for a while and you have, or, maybe you've done more professional based work in a related field, having a reference from that is fine as well. Okay. And then for your application, if you are accepted to the program, we'll ask you for official transcripts at that time, but at the time of your application, you can just upload unofficial transcripts. Okay. And then if, let's say you don't have an honors bachelor's degree, then you can go an alternative route to applying to the program, but you have to have completed your degree more than 4 years ago and provide relevant work experience. So in that sense, your extra training would be your work experience that would give you the kind of competency to join the program. And then in that situation, we also require your references. Maybe if you've been away from academia for a while, it may be easier for you to get professional references from that related work experience, which is fine. And then a little bit about our selection process. So every application is reviewed by our admissions team. What that review looks like is looking through your transcripts, all of your answers to those questions that we pose, looking at your CV. So really we take the whole application as a whole and look through it. Those students that are sort of shortlisted will then be invited to interview for the program, and we're anticipating that they'll be held kind of in mid-February. So that should say 2023 actually. So in February 2023. So we do interview students. It's a 30-minute interview where you meet with 2 faculty members, really just again to get a sense of your experiences and your thoughts about the program, and sort of asking specific questions about kind of your experiences and ensuring that you have some of the competencies that we're looking for in our student population. So just to be kind of aware of some deadlines for the application, we did move our deadline earlier this year if anyone applied last year. So our application deadline is November 4th. And then if you have any outstanding references, those must be submitted by November 16th. Okay, so just some couple deadlines to keep in the back of your mind. And then, you know, this is unfortunately, education does have a cost to it. So just to be aware of the fees for this program. So they're just under $4,000 per term to join the program. If you're an international student, that is a bit higher. And that's just sort of the differences. These are sort of fees set by the university. Okay, so again, they're sort of comparable to other professional-based programs at our university, but just to be mindful of the cost. Now, again, you can find these fees on the university website under the registrar's section of the website. And then we just want to highlight that we do have our website. So any questions that you might have that you want sort of answered, we actually have a lot of questions. If you go under the prospective students and under our frequently asked questions tab, there's actually several questions that we get from students that we've now put responses to there. So you might have a similar question, so I encourage you to take a look through that FAQ to see if some of your questions can be answered there. Okay. So thank you so much for kind of listening to that. Well, next up, I'm going to hand it over to Sarah and Laura. So again, 2 students in the program, just to share about their experience in the Graduate Psychotherapy Association, as well as sort of their sort of experience in joining the program so far. So I'll turn it over to Sarah and Laura.
Sarah, do you want to go first or you want me to go first?
You can go ahead.
Okay, perfect. Okay, hi everyone. My name is Laura Grennan and I am the president of the Graduate Psychotherapy Association. The Graduate Psychotherapy Association is a club that was started by the very first cohort of students. And it's basically just to hold events related to psychotherapy, organize things like our speaker series, have get-togethers for the program, and explore some educational opportunities and have guest speakers come in from various areas related to psychotherapy to talk about their area of the field to kind of boost our learning. So yeah, we are in our 2nd year of the program, and so far I've had a good experience in the program. I'm jealous that you guys would hopefully be able to be in person for most of the program, but even with that being said, the virtual learning was still pretty good. I really like that the program has a focus on evidence-based psychotherapy and is really rooted in research, but not forcing you to do your own unique research and having a research project and all that kind of thing. I do like the really small class sizes and find that the classes are very interactive. And I think that what we've learned in over the course of the first year of the program has set us up pretty well for our practicum placements. Which have also been really great experiences. My first practicum placement was within the hospital, so St. Joe's West 5th, that they briefly showed a picture of, and then I'm currently in a private practice setting. So so far, I've had a lot of really great experiences with the program. Pass it off to Sarah.
So Laura's pretty much covered most of the thoughts I had in terms of the program. Like Laura, I did my first practicum placement at St. Joe's West 5th, and I've continued at the same practicum placement for my 2nd practicum. So I'll be there until April, sort of like April to April. It's been really enriching. I feel like in my experience, the classes that we took in first and second semester, first year, really set the stage for us to have that like foundational and like conceptual knowledge needed to be able to enter practicum placement and feel like you have that behind, like you have that sort of strength of information to go into placement, because you are interacting right away with mental health professionals like psychiatrists, psychologists, social workers, OTs. So it's really good to be able to, you know, go in there and have that foundation, that solid foundation. And then second practicum, well, even towards like the end of first practicum and the second practicum is where they really give you the opportunity to not just observe, but to start practicing. And in my experience, and I think Laura can attest to this, there's a lot of support for students in placement. So if you're nervous, I wouldn't be too nervous. You are supported and you're not alone. And as Laura said, you kind of progress with all the same people. So you do have a support network of students too. Yeah, I mean, maybe if anyone has any burdening questions for Laura and I.
Perfect. Thank you so much, Sarah and Laura. I really appreciate you sharing. And I think one thing you both touched on, which I'll just share a bit more about, is sort of the practicum experience. So as we mentioned, there are 2 practicum classes, and we do really work with students to help them find their placement. So I think sometimes practicum can be a bit of a stressor for people, but we really have a large kind of number of practicum now that we've become affiliated with. And so far, each student has been sort of successfully matched to a practicum.
Video, and I'm just going to go through a couple of the key dates just to remind you about the new deadlines, considering what was in the video was old. And then what I'm going to do is I'm going to invite our current students to have a quick word with you. So let me just, okay, so just to remind you that our deadline this year to submit applications is actually November 14th. And if you have any outstanding references, they must be submitted no later than November 21st. Please note that your application absolutely has to be submitted before the application portal closes on the 14th. Okay, so don't delay on that. And then just to let you know, there are some updated tuition fees. So for Canadian citizens, it is still the same, but for international students, the university did bump it up slightly. So those are the amounts. And again, just a reiteration that yes, we do have our website. Everything is on our website. We have a very detailed, fleshed out, frequently asked questions section. So you might want to take a look at that as well. And that hopefully will help answer any questions that you have. And now what I'm going to do is stop sharing. And I'm going to invite a couple of our students that are currently on the call. There we go. I see Maggie. And there's Madison. Thank you, Madison, for helping. And Jessica. So I'm going to turn it over to these ladies, and they will talk to you about their experiences in the program, as well as their experience during the application process.
Hi, everyone. I can get started. I'll just introduce myself first. My name's Maggie. I'm a second year in the psychotherapy program. I'm also a member of our Graduate Psychotherapy Association, or GPA. I'm the VP of events. I'm doing my practicum at the Women's Health Concerns Clinic at St. Joe's. So if anyone has any questions about practicum or anything like that, we can also answer those questions as well. I don't know if you guys want to introduce yourselves too.
Yeah. Hi everyone. I'm Jessica. I'm also a second year student and part of the GPA. My role is the president of the GPA this year. And I am placed at Thrive Counseling. It's an agency, private practice in Burlington, Ontario.
And my name is Madison Lester. I am also a second year student and part of the GPA. I am the VP of social media. So if you already follow our social media pages, you've probably seen things I've posted. I am doing my practicum at the Anxiety Treatment and Research Clinic at the West 5th Hospital.
I don't know if we want to take questions right away, or
Yeah, if
we
there's
can...
any pressing questions from anybody, and Susan, I don't know if you're monitoring the chat, if there are questions there that
I'm
we
just
could
starting to go
answer.
through the chat now, but do you have any like, how did you guys find the application process? Is there any tidbits you can give everybody here on the call as to what made you successful, or any kind of information you could share?
Yeah, for sure. And basically my experience, I can't speak to yours, Maggie or Maddie, that I guess just being yourself and being honest in your application is what they want to see. It is very, very competitive, so you never know. But yeah, just being open and honest about your experiences and your work experiences, and talking about what you'd like to see out of your years in the program.
Yeah, I think I'd agree with Jessica there. Just, I'm trying to even think back to the application process. It feels like so long ago. And I know it's a really stressful process when you're trying to get all your documents in and everything, and references. But yeah, I think the main thing is being honest about the experience you have and what you want to get from the program. And I think this is like a really unique program in a lot of ways. And it really provides good practical experience. So if that's what you're looking for, I definitely think that it's a good opportunity for that, and really important to kind of highlight the experience you do have and what you kind of want to get out of it as well.
Yeah, I'm again just not gonna add too much to your guys' answers already. I'd say the application process was pretty standard across all of the places I applied. I don't think this was any more like strenuous or asked for a lot more than anywhere else. But again, just being honest, being yourself, especially if it comes to an interview. They're really just looking to get to know you at that point. So.